Good afternoon, everyone. Thank you for joining us today. Today is our fifth and final session of our health equity webinar series. Today, Lindsay will be going over implementation and evaluation. Our previous four sessions are recorded and on YouTube. If you have any questions, please do not hesitate to reach out to me. As always, we are a smaller group, so if you're on the live call, feel free to unmute your line, put something in the chat. I know Lindsay mentioned we have more time and more discussion points built in, so hopefully we can have some good discussion today. If you are watching this recording and have any questions, please do not hesitate to send me an email. With that said, Lindsay, I'll turn it over to you.
Thanks, Laura, and good afternoon, everyone. Thanks for having me. As Laura mentioned, today we're going to really wrap things up with thinking about our health equity plans from an implementation and evaluation perspective. So, again, we're on this journey, so don't get discouraged if you're just kind of still in those initial phases of health equity. But I would love to hear more about maybe some areas that you're struggling with, or where maybe some bright spots as you've kind of moved over the last several months, kind of heard some more information about health equity, certainly more information about the MBQIP measure, and hopefully some examples of how we can start to implement and strategize around health equity. Pulling it all together. So when you think about, and I know for some folks, we're not even there yet. We haven't even decided, and we haven't even explored the data to even make informed decisions. That's okay. But, we're going to have a goal, and it has to be around implementation. So taking that data, that data and that information, and making those informed strategic decisions and developing those plans to implement. And so that's really what we're kind of working towards. But to date, we've really started to touch upon the importance of a health equity strategy. We talked a lot about the data collection and data use. We talked about partnerships and collaboration as really a key driver and a key component into advancing our health equity strategy. In that whole, we can't really do it alone. We shouldn't operate in a vacuum when it comes to this. And even Deborah mentioned partnering with the county health department for some diabetes classes. I mean, yes, you can probably take that on your own, but you're also, connecting with maybe a whole another patient population and access to additional resources by partnering with the health department from a county level. So really nice job there. But I put up this kind of chart because I think that this helps us understand, of all these kind of buzzwords and topics that we've talked about, they are all very much interconnected. And so how do we kind of think about this in the grand scheme of things here? We think about health equity being at the top, right? That is the goal. We are trying to achieve equitable health for all. And it's that equal opportunity to be healthy in absence of obstacles to health. Health equity is the goal. The social determinants of health, or the social drivers of health, they're really around the strategy to advance the goal of health equity. Then we also have health disparities, right? Those are kind of the ways in which that we measure and track progress on the goal of achieving health equity. By reducing health disparities is really one way to demonstrate progress towards achieving health equity. So kind of just think about it in this kind of, they build upon each other with the ultimate goal of achieving health equity. And just to also reorient you all, as a reminder, what we're talking about is this plan, right? This kind of health equity plan. And it is referenced in the MBQIP measure of domain number 1, and it's titled Equity as a Strategic Priority. So you are attesting to that your hospital strategic plan, and it could be your overall plan, it could be a pillar within your organizational strategic plan, it could be a separate plan, it could build off of your community health needs assessment, but it is a plan that is as it relates to health equity, identifies healthcare equity goals and action steps to achieving those goals. So what is it that, like any strategic plan, right? We have goals that we've outlined for our organization. And we have the key initiatives in which that we are going to tackle or action steps to achieve that goal. And so really that's kind of how we're going to move through and that implementation. We're going to define what that goal is, and we're going to develop these action steps to achieve that goal. And we'll work through that as it relates to that implementation. So what are some of the 5 kind of characteristics from an improvement plan or an implementation plan, something that we are going to set forth and do? It's really a process that really has to include leadership. There has to be a mechanism for accountability, and it has dedicated resources. And so, I've mentioned numerous times that leadership is so important as it relates to this health equity domain. It comes up quite a bit from even data collection and data analysis, that we need to have that leadership support for developing that data infrastructure. Same thing for strategy and any type of kind of implementation plan as well. Leadership support, accountability, and dedicated resources. The plan uses data. There's measurable outcomes in the progress towards maybe an evidence-based benchmark or some type of goal that we have set forth for ourselves. And data is either the way in which we develop the goal or come to developing the goal, and a way that we can track the outcomes and the progress towards the goal. There's linkages and efficiencies and provider and client expectations when improving outcomes is a characteristic of a plan. And then there's continuous process. It's really, again, it's this continuous process that continues to adapt and change within the organization. Oftentimes organizations will apply quality improvement methodology to go and, continuously improve that plan. Maybe it's a PDSA cycle or some type of continuous improvement methodology. And data is collected, over the course of time, really to ensure that the goals are met or accomplished, or there's, that continuous improvement as well. I feel like I'm repeating myself when it comes to this leadership support and buy-in, but so essential when we're thinking about strategy, title, even the title of the key domain. I mean, your organizations are attesting to that you have adopted health equity as a key strategy for your organization, domain number 1 of the MBQIT measure. So, when it comes to strategy, there has to be that leadership support and buy-in and that commitment to health equity. And our plans are not sustainable, long term if there isn't that support for health equity and beyond. We want to ensure that we embed health equity principles and practices into our organizational culture. We mentioned this a little bit, around when we talked about strategy, and it's really kind of focusing internally first, right? We kind of need to think about how we as an organization operate, and have we done the work internally before we can really start to look at externally. Think about how we can improve our culture from a health equity perspective as well. Making sure that we provide education and training on cultural competencies, implicit bias, and health equity. I think that's an important, if that's a key next step for organizations that are starting on this journey, is the education part, right? Internal education for our own workforce and our leaders to really get them on board, get them to get the buy-in that we need to then begin to take the next steps as it relates to health equity. So often I see organizations don't do the work on the front end jump into the middle and they lose steam when it comes to implementation because there hasn't been that initial work creating that support and that buy-in, that commitment to health equity at the front end. And I think it can be said for a lot of different kind of initiatives that organizations set out to tackle, even with our own strategic plans. If we haven't, shared and articulated and gotten input and from others of our team, whether it's from our leadership or even just a overall, organizational wide input, then some of the initiatives within strategy do not move forward. They cannot get outside of that initial phase. We want to make sure that we're promoting diversity and inclusion within the health workforce. I think that's, again, very internal, really helps with that organizational's commitment to health equity. And then really fostering that environment that values and respects different cultural backgrounds and perspectives. I think that goes unsaid. And so taking, again, we want to do the work from the internal perspective, do the work at the forefront. And then as you continue to work through, we come to a landing spot of, okay, we're ready to develop kind of this action plan or this strategy with action items that support a goal. And so, part of the strategy is identifying specific populations. And, that's where that data element comes in, where we have leveraged the data to identify specific populations or target population area of focus. And then we can start to think about our goal. What is it that we hope to achieve? We'll talk a little bit about goal setting on the next slide here. And then think about within the action plan, what are the strategies and the resources needed to achieve the goal? And we'll talk a little bit about resources too, as well. And then what's the process that we're going to use to monitor and report progress? Yes, it's one thing that we can develop the plan. We have all these action steps, but how do we know we're going in the right direction? How do we know, what type of data do we need to collect to go back and say, are we trending in the right direction? Do we need to pivot? Do we need to make an adjustment along the way in order to meet our goal or trend towards our goal? Maybe we need to change our goal. Again, things that happen along the way. And, I think organizations will certainly, as they continue to go down this path and implement and execute on different strategies, you're going to learn a lot of lessons. You're going to learn what approaches work for your organization, for your community, for your target population. And then there will be changes, of course, along the way. And I think that's such an important aspect to say, is that there isn't a one-size-fit model for this. Strategies are going to be different for every organization. Approaches are going to be different, and things that work for one, population may be different for another. So we need to just kind of continue to evolve in that regard. Has anyone heard about SMART goals? So you've probably all heard about SMART goals. And so we think about when we set goals, we've often heard that we should, consider setting goals and establishing goals in a SMART kind of format, ensuring that they're specific, that they're measurable, that they're attainable, that they're relevant or realistic, and that they're time bound. Those are SMART goals. And not too long ago, there's been some introduction to what's known as SMARTY goals. And the I stands for inclusive. So bringing traditionally marginalized people, particularly those most impacted, into processes, activities, decisions, policymaking in a way that shares power. And then E for equitable, seeks to address systematic injustices, inequity, or oppression. So think about now kind of transforming our SMART goals into SMARTY goals, which are now more inclusive and equitable. And some key, here, is a SMART goal and how we've kind of then transformed it into a SMARTY goal. So a SMART goal, you may have build a volunteer team of 100 door-to-door canvassers by May. So it's, again, specific, measurable, attainable, realistic, and time-bound. Then we add in the inclusive and equitable, with at least 10 people of color recruited as volunteer leaders first, so they can help shape the way we run the canvases. Now we're thinking of a more equitable and inclusive way to define our goal. Some different steps are kind of key ways that we can think about making SMART goals more inclusive and equitable. Consider diversity, making sure that when we do set our goals, consider diverse backgrounds, experiences, perspectives of individuals and communities. Given that hopefully our goals are very kind of grounded in the health equity space or the social determinants of health, we have, there has been a role that diversity has played in that. So hopefully, making sure that we consider diversity. Address the inequities or inequalities, identify and address existing inequalities or barriers that may prevent certain groups from achieving the goal. Very much when you may do some internal housekeeping and look at your policies and procedures. Looking at, is there a certain group or types of folks that are excluded from said policies and procedures. So looking at it from an inequitable standpoint. Engage stakeholders. Consider outside input, seek feedback from other stakeholders, whether that be underrepresented or marginalized groups, to ensure that the goal is relevant and achievable for all. Are we missing anything? Are we not, do we, we want to make sure that we seek the feedback from external groups or folks that may be in this space more so than we. And then assure accessibility, consider accessibility and make accommodations for individuals with disabilities or other needs, and measure progress. Use metrics that are and consider the impact of the goal on different communities and track their progress towards equity and inclusion. So really consider, as you're looking at goals and making those goals SMART, see if we can really think about them from an inclusion and equitable standpoint as well. As we, think about our action plan, one key aspect is around priority and how we set, we may have lots of different goals. We may have lots of different ideas when it comes to, developing our strategy around health equity. And, one thing that really helps us out when we think and help organizations with strategy is around, how do you prioritize? How do we, if we have a whole bunch of spaghetti on the wall, right? What are those ideas, those key initiatives that are really going to go to the top? And how do we prioritize? And there's different tools out there. I'm going to share just a couple that really helps us start to think about and prioritize those key initiatives. And this here is a matrix, and it really just kind of looks at that the different priorities, which you see listed here. This is just an example, but there's, medication errors, high readmissions, ER backlogs, and so forth. Those are the different priorities. And then you would fill out a weighting for each of those priorities in the different criteria. And you'll see, from a total standpoint, which is of higher weighting than the rest. And so if you took, high readmissions, is this a low cost or a high cost to the organization? Is it a strategic priority? Does it meet a certain standard? Is it a concern for a physician or medical staff, or a staff concern? And thinking about and then totaling that. And then you can start to whittle down and understand where that prioritization lies. This here is an impact and effort matrix. And so again, the spaghetti on the wall and all of your ideas that your team has come up with on how we can reduce readmissions in the Hispanic population. Okay, because our data has shown that we have between different ethnic groups, we have a high rates of ED or readmissions in the Hispanic population. That's going to be our goal. And then we have different key initiatives that we're going to throw on the wall, right? And so if we put it in an impact and effort matrix to try to kind of reorganize ourselves in terms of priorities, is the impact to the organization high or is it low? Is there the value of the initiative? Would they have a high impact to the organization or a low impact to the organization if completed? Is the effort high or low? Is the time and the resources needed to complete the initiative high or low? And you can kind of see where maybe each of those initiatives lie. And so you may want to focus on those high impact, low efforts, those quick wins, those initiatives that we're just going to go for it. We know that this is going to have an incredible impact on those readmissions and for our organization. And it's relatively low resources, and low commitment of time. So those are the quick ones. Or you may have more in that high category, high impact, high effort. They're transformational. They're long-term planning, high effort for execution. So again, you can kind of see where, your priorities may lay. And lastly, from an implementation prioritization exercise, this one here is just a matrix around feasibility and importance. And where you would start to come together with, again, the spaghetti on the wall, the key initiatives that your organization wants to tackle on, reducing readmissions of the Hispanic population. Is these initiatives very feasible to address? Or are they less feasible to address? Are they very important for the organization? Or are they less important for the organization? And kind of where do those fall in terms of this feasibility and importance prioritization metrics? These are just some tools to help because, again, as you continue to embark on the action planning and the implementation phase, lots of different key initiatives are going to come forth. What are those action steps that we should be tackling first versus something that we need additional resources and time and lots of effort to implement. And that's a long-term strategy or a long-term initiative. And so kind of thinking about how you prioritize and work through all of that is really helpful. And so mapping it out or kind of putting it into a matrix with your team and really discussing what makes sense from your perspective really will help fill in and develop that action plan and those key implementation steps. So moving along, and this is kind of making it stick, right? How do we sustain key initiatives? And a couple different topics around key initiatives and making those sustain long-term or getting implemented and having some withstanding power, if you will, is around performance monitoring, continuous performance monitoring. And I think this kind of crosses into that evaluation as well, which we'll talk about in the next section. But, having this performance monitoring, having these metrics and these key indicators to track progress and evaluate outcomes, towards those goals that are either SMART or SMARTY goals. Is there additional metrics that we can be measuring, continuously looking at our data from a stratification standpoint? Again, stratifying meaning to differentiate our data. And making sure that that data that we're monitoring, we can measure that impact of the interventions or initiatives. So have we established those pre and post data elements? And some other items kind of within performance monitoring, maybe we need to think about quality improvement assessments and kind of moving things forward from a quality standpoint, root cause analysis, certainly. I think when we think about, getting to the root cause of what may be driving factors for our high readmission rates, that's one way to kind of look at and start to tackle. Have we done, a root cause analysis? Do we have a better understanding about some of those driving factors? And then developing kind of those action items that will work to kind of solve or mitigate some of those causes. Run audits continuously, to really kind of identify any of those gaps, look to refine strategies, and ensure that ongoing progress. Utilizing a quality improvement framework to drive those continuous improvements. I mentioned that PDSA. Encourage that culture of learning and innovation and adaptability. Don't just settle for kind of status quo, continuously reshape, reform, and innovate. I think we get, if we kind of get stuck in, moving forward and sustaining some of our initiatives, maybe that's an opportunity to pivot a bit. Maybe we pull in and reshuffle our team. Maybe we tap into outside partners a bit more. Think about kind of what your key action steps and initiatives are. And maybe we just need to kind of pivot and reorganize. But I wouldn't abandon early on. I think encouraging that, tapping into outside resources, if you do get stuck in terms of that ongoing progress. One big area that always comes up is certainly around resources and funding. And, often hear that, one, we don't have a lot of resources in terms of our staff members and FTEs to be utilized to support, health equity initiatives and the items on our action plan. And how are we going to support, investments in health equity and some of these key initiatives without adequate funding? I hear you loud and clear when it comes to that. And I think that's that's a concern and a real barrier for a lot of rural hospitals. I hear you. And I think when we think about resources and funding as it relates to health equity, we need to have planning and conversations about how we can continuously support efforts for that long term. And so some of the, certainly grants out there they're available. There's lots of funding. Sometimes it's a bear to even have to look for it to even begin to, understand where to even start to obtain a grant, to write a grant. But there is available funding, and, things like HRSA or CDC or Office of Minority Health has different kind of grants out there, depending on maybe a certain topic, depending on maybe it coincides with your key initiatives or your goals as it relates to health equity. And so maybe thinking about that to secure some additional funding to support your key initiatives. Foundation grants are really great. Again, they too typically will focus on reducing healthcare disparities, and they may, coincide with what your area of focus is. So I know I was just in Texas a couple weeks ago, And they actually have like a whole website, and I want to say it might be through their state office of rural health, or maybe a rural community partner, but all of the different foundations within Texas, and then some national foundations that are all focused on certain areas. So they're like indexed, and you can like go on their website and just look at all these different foundations and what those foundations are supporting. And so, going through and maybe, doing an application, for a grant or some additional funding through foundations, might be the way to go. May not support long-term strategy, but could provide some initial funding. But then that's the key, is to have those conversations. That planning is, how do we continue to sustain kind of long-term? And maybe that's around kind of, assessing your resources internally. Is there areas where we can repurpose or reprioritize various resources or funding, whether it's staff time, training budgets, operational expenses. If we're committed to health equity long term, and our initiatives are meeting our goals and we're achieving these desired outcomes, does it make sense to repurpose some internal funds elsewhere? And again, that's an internal conversation, but one that would need to happen with leadership, and that you would have that commitment and that buy-in around. Exploring value-based contracts may be an opportunity, depending on what your area of focus is. Is there key initiatives or things that you're doing that may tap into some of that enhanced reimbursement from commercial payers, or your accountable care organization, or some type of alternative payment model? And those may be a way that we can tap into some internal or external reimbursement initiatives, and other, maybe telehealth reimbursement, community fundraising, research grants, and different partnership opportunities. I think the resource and funding really comes together too in that community partnerships, where we can pull together collective resources, or we can collaborate on grant applications, and that, it doesn't always have to be the hospital being the source of all the funding and the work, right? We can start to collaborate and elevate and leverage those community partnerships. Okay, so the evaluation part. So, once we've kind of implemented and worked to sustain, how do we know that we did all right? How do we know that we've achieved our desired outcome? And I think some important aspects when we think about evaluating the work that we have done as it relates to health equity, and why it's so important to have some evaluation mechanism, right, is that it builds that accountability. And whether it's to our own selves and our organization, or it's from the leadership team to our team, that's really putting forth the initiatives and working through the action plan. But it can also help sustain and support health equity initiatives longer term. So, some key aspects to that is really developing this regular reporting on health equity progress and outcomes, whether that is included in a board report, at your quality improvement meetings or committee meetings, reports to medical staff on progress and outcomes, very, very important. And also part of the key, some of the key domains of the MBQIP measure is, what is that kind of reporting mechanism, whether that is on a kind of scorecard or a dashboard that's included and shared with the board, with leadership. And so having that reporting, that regular reporting, is really essential. Make sure that you share updates I would say updates, progress, outcomes, great stories with leadership, staff members, community folks, maybe regulatory bodies. I think getting folks, to better understand the work that has gone into your health equity key initiatives and the outcomes that you've achieved is a great story, and everybody loves a great story, and to show the progress that your organization has made for reducing disparities and improving health outcomes. I think is so vital for organizations, and sometimes we become our best kept secrets because we don't share and kind of share all of the good things that we're doing. So share, promote yourselves, because you know what? That community organization that has some really great ideas, but didn't know that you also are working in the same space, maybe the next partner for you all, and really will help you then continue to advance and sustain some of your initiatives. So promote. Also, knowledge sharing, I think, is really important, that we want to make sure that you consider as part of your evaluation, and think about how effective your interventions have been. Has there been best practices, and how do you disseminate lessons learned internally and externally? One, I think it's domained. Gosh, don't quote me now. Domain number 4 of the MBQIP health equity measure is around quality improvement. And it's that participation in quality networks, or a way for shared learning and sharing of best practices, and being able and participating in that as it relates to health equity. And I think, that's a really great way to start to evaluate your own program. Are there, can you obtain feedback from outside folks? Maybe you learn from others on where you may be able to improve your strategy. You'll maybe think about how you can refine and enhance your strategies going forward. So I think, participating in networks and collaborations is really important, and also sharing internally and kind of doing those debriefs as well. Last bullet point under evaluation is really assessing the implementation process. How did we do? Were there barriers that we encountered? Were there challenges around resource allocation? Did we really excel at our training effectiveness and getting folks on board and getting that commitment and that buy-in from our leaders? And how did we do in engagement of others, whether it's community partners or our internal staff? So thinking about, lastly, before we kind of jump in and have some time for some open discussion here, is our, just kind of bring it all together. Some of our keys to success as it relates to health equity strategy. Start small. As I said, start small from a data perspective, from an idea perspective. Get some of those wins under your belt, and celebrate them. We're not going to solve all the inequities and the disparities within our community on the first run. This is not a sprint. It's a marathon. Nice little Olympics reference, but and we really need to think about it in that regard. And so don't get discouraged if the first item, your core key initiative, does not is not successful. Continuously evolve and learn from that. really get that leadership support. Whether if you're struggling with that leadership support, is there some additional resources or some education and coaching for our leaders to get that support and that commitment? We really want folks to be forward thinking, and not settle for the status quo, and that, achieving that optimal health and equitable health for all needs and requires kind of forward thinking. We can't just think, from what's happened in the past. We really need to look forward in our approaches. Collaborate, partnering with folks within the community, community-based organizations, community members, patients, families, internal staff, participate in networks, because we can't just do it alone. We can't just kind of go out and tackle this large of an initiative by ourselves. So even if we do start small, think about ways that we can engage others and get those wins, right? Seek and develop a data infrastructure is so vital, given that a lot of this work is data driven, right? We assess, we're looking, we're collecting data. And if we don't have good, reliable data, we will not be able to make those informed strategic decisions. So developing that data infrastructure is vital for organizations as you continue to evolve and move towards, achieving health equity. So, I leave you with these kind of 4 kind of keys to success as it relates to health equity and really looking at the meeting those MBQuit measures. I think these 4 items kind of touch on the health equity domains of the MBQuit measure. Okay. Well, as always, I have contact information here. Feel free to reach out if you are kind of struggling or, want to bounce any questions off me. Feel free to reach out or send Laura a message and she'll make sure that we get in touch as well. But thank you all. Thanks for your participation, and look forward to working with you in the future.
Thank you, Lindsay. Everyone have a great day.